Great. Hi, everybody. Thank you so much for joining us for our Youth and COVID-19 series, our series of live streams that we've been doing, talking about how COVID-19 is impacting young people, especially from a public health angle. So we are so excited to have you here. My name is Tova Kaplan. I'm a COVID-19 fellow with AMP Global Youth. And we are so excited to have a special guest today. I'll let him introduce himself.
Hey, so I'm Satvik Sethi. I'm a 22-year-old mental health activist and social entrepreneur, and I'm the founder and chief executive officer at Runaway, which is a social entrepreneurial venture that aims to promote mental health awareness and helps those in need of emotional support through a lot of free resources, information and education, and mental health guidance.
And thank you so much for being here, Satvik. We're really glad to have you. So we're just going to have a conversation about how mental health is being impacted by COVID-19. So first off, have you seen in your work an increase in mental health struggles among the young people that you've worked with? And if so, why do you think these mental health struggles are increasing?
Sure, yeah. So, right from the start of the year, there's definitely been a huge increase in mental health struggles that people are having, and it's due to anxiety, due to stress, due to depression. But I think COVID-19, while it is one of the biggest factors that's impacting mental health, mostly because of the social isolation aspect of it and not being able to see your friends and family, there's also a lot of other factors that often get neglected while talking about the mental health impact of COVID, such as just COVID anxiety in general. I know myself, I try to not venture out too much because I'm just scared that I could get COVID and everything that would follow. There's things like mask anxiety that have been pretty rampant recently. So definitely a lot of factors there, but just looking at the year itself, there's so much else that's been going on besides COVID that I think is really impacted people's mental health. There's uncertainty about housing situations, about people's jobs. There's police brutality, incidents of racism in the news, and now one of the longest election periods that we've seen. So it's definitely a lot going on, but hopefully things will start to get better. And, there's definitely a huge kind of flux of resources out there in the market now. Everyone's sharing different mental health resources, crisis helplines that people can reach out to. So I'm really hopeful that people are taking care of themselves and managing their mental health.
Yeah, for sure. It definitely is very overwhelming just in the news cycle, seeing everything that's happening. It feels like so many things are happening at once. And do you think any of these mental health challenges that you've talked about are uniquely impacting young people? Are there any struggles that are specifically happening to young people?
Yeah, for young people, I think while these struggles might be universal in terms of the age groups that get impacted by it, I think young people specifically are struggling because there is lack of resources that are specifically targeted towards young people. And even if the resources exist, they're not exactly always accessible. I know personally a lot of people reach out to me to ask about different therapy options or, where they could find mental health help that's completely free or somewhat affordable. And I think especially as a student, you really struggle to find these right resources. Also, obviously, for young people, just schooling and education right now is so badly impacted. Homeschooling is not always the most ideal environment for most people. I graduated this year, and the start of the year, I had to attend like a month of virtual classes, and that in itself was too much and such a burden. So I could definitely feel for anyone who's had to do the whole semester online and just kind of the stress, uncertainty, and anxiety that it adds to your life.
Yeah, and congratulations on graduating during a pandemic. That's
Thank you.
That's an opportunity. You'll like be able to have that forever. Like I know my grandparents always guilted me like, oh, we walked like so many miles to get to school every day, and now we have that like guilt over our future children.
Yeah, and hopefully you won't have to use it, but always
Yeah.
add that card.
Yeah, for sure. I'm a junior in high school, so I've had like last year half of our school year was online. This year, at least half's going to be online, but I'm in Chicago and we're not doing that well in COVID cases, so probably will be online for at least the rest of the year. And I've definitely seen among people I know, as I'm sure you've experienced, young people already have disproportionately high mental health struggles. And I think with the pandemic, it's just amplified that, unfortunately. And as you were mentioning with the social isolation, teenagers or young people in general are very like social people, and we need like that interaction and support that we haven't been able to have. And you actually have created an app to help with that, right? The Runaway app. Do you want to talk about your inspiration for creating that and the impact that it's been able to have?
Sure, yeah. So my journey with mental health almost began accidentally about 7 years ago. It was when I was in middle school, and myself and a lot of my friends around me were struggling with mental health problems. But obviously, at the time, we didn't really know these are mental health problems. But I somehow became someone that a lot of my friends felt comfortable talking to about their own struggles. And at the same time, I started going online on Instagram and finding people who were using the platform to reach out for help, and ended up talking to over 450 strangers over the years, just going online, finding them and reaching out. So when I came to college, it was a very challenging time for me personally, and my mental health wasn't the best. So at this point, 4 years ago, I had to make a decision whether to keep having these conversations on Instagram and kind of, affecting my mental health negatively, or to create a way where other people who are passionate about mental health can help me. And that's where the idea for Runaway really came about. Over the past 4 years, what we've been able to create is an amazing team of about 20 student volunteers from around the world. We also just added 107 peer support volunteers, and we've hosted events on college campuses. We've conducted mental health research with organizations like Mental Health America, UNICEF, and Wellcome Trust UK. And finally, 4 years later, the dream that it all started with, the app, is completed. So this is going to be the first of its kind mental health resource. It's going to be completely free, completely anonymous, and it's going to have one-to-one peer support with our peer support volunteers who are just going to be a friend to you and let you have a safe space where you can talk about your problems. It's going to have a lot of education and information. It's going to have free resources from our partners, as well as crisis contact information for anyone to access. Signups are live right now. Subtle plug, but tinyurl.com/I'm happier. So you could sign up right now to try it out before it hits the app stores.
That is really amazing. I think it's great that you are providing like a peer-to-peer avenue, because I know a lot of young people are like afraid to reach out to adults for fear of being judged. And also, I just think like generationally, because society is like moving so fast with technology, it's hard, no fault of their own, but it's hard for older generations to, I think, understand the unique challenges of being a young person, especially during the pandemic. Everybody's experience is different generationally. So I think that's amazing that you've provided that avenue. I'm sure so many people will benefit from it. And that's really amazing. I'm sure people's lives will be changed by that. And I like that it's free too, because as you mentioned, socioeconomic barriers are a huge barrier for getting access to mental health.
Yeah,
So
absolutely.
yeah. And so just a personal question, has your mental health been impacted at all by COVID-19? And if it has been, like, how do you, I mean, you're like the mental health expert. So do you have any, like, can you just provide some information on how you personally like handled your mental health and kind of stayed sane during this time?
Yeah, sure. So for me, honestly, as privileged as it sounds, when COVID-19 started and we were all kind of told to stay indoors, not, minimize social activity, I was one of the few people who was really happy about it. I always kind of told everyone that, I enjoy spending my alone time. It gave me a lot of time to work on Runaway and some of my other projects. I didn't have to have too much social interaction, could wear sweats all day without anyone bothering me about it. So that was good, right? But then in July, I moved apartments and I moved to this completely new city where I really don't know anyone around. I'm living in my apartment alone. And at that point, I started to realize that, okay, maybe I don't enjoy being alone all that much. And I could definitely kind of see my mental health struggles flare up. So I started having really bad anxiety living alone. I fell into depression for 2 months or so once I moved in here in July. And it gradually kind of took me a little while. I started having more social interaction virtually. I started having Zoom calls with my friends or FaceTiming my family back home in India. And that started to kind of help me feel better. But I would say, for me as a mental health activist, it's always this fine line that I feel like I have to walk. Like you said, people expect me to have my mental health in order. But I've realized that that often kind of creates a barrier where people, think that, okay, this person has their life sorted, so there's nothing that they could experience that would mimic my experiences. So one of the things that I started doing this year is being more vulnerable about my own mental health. I stopped pretending that I'm always okay and always trying to be strong for those who look up to me, but also tried to show people who follow me on social media or just interactions I have with people that I am also a normal person. And just like your mental health goes bad from time to time, mine does too. And this is what I do to take care of it. So for me, I always give two things as advice for anyone struggling. And this is something that works for me is one is self-care. So that just means recognizing when your mental health is bad and taking breaks to take care of it, and just loving yourself. Stop always kind of complaining about what's wrong with you and start to appreciate the little things that you're doing right. Celebrate your accomplishments. And the second thing is self-indulgence. So this is honestly my favorite bit, is just doing things that you love doing. For me, that could mean eating a pint of ice cream while watching my favorite movie, or going out for a walk, listening to my favorite music, or simply doing nothing at all and just laying in bed staring at the ceiling. But I really think that that self-indulgence and just doing things that make you happy, especially now when there's just so much wrong with the world and so much pain going around, I think those moments of just treating yourself will always help you feel better.
I can totally get behind that. That is great advice. I think that is manageable, like treating ourselves well. But yeah, that's great advice. And I think I applaud you for being really open about your own mental health like struggles, because I think in this age of social media, it's so easy for us to only project our perfect selves, especially when I think it's even easier to fall into that trap when we're all isolated. Like, I haven't seen most of the people in my life for 10 plus months, so I don't know what's going on with them. Most people I know haven't seen me in 10 months. They don't know anything that's going on with me. So it would be, and I'm sure it's the same for you, and it would be so easy, even more easy than normal, for us to just project like only the good things that are going on in our lives. And I think it's such an urge to just in this like social media driven world, for us to only present ourselves as just these perfect people who never break down, never have stress. There's also, I love that you mentioned like taking time for self-care, because I've seen this whole like productivity culture kind of explode during quarantine, which isn't a good thing. Being productive is great. I love being productive, but I think there's kind of a toxic culture brewing where it's this idea that, well, you have free time. Now that you have free time, you have to fill every second up with doing something, or you're like a useless person.
Completely agree.
Yeah, I saw so many articles like, here's how to fill every hour. You should wake up early. You should do everything. You should learn a new language and learn all these different skills, which if that makes you happy, great. But I totally agree that you can't do that at the expense of your self-care, self-indulgence. It's not a bad thing to take time for yourself. I definitely struggled with that at the beginning, because I kind of had the opposite as you. I'm a huge extrovert and I like need to be around people. So being alone, I was like freaking out the first few weeks, which sounds hilarious to time it in weeks versus months, but that's what I thought it would be originally. I like looked up every online program. I tried to fill every hour of my day. But now I've like gotten to that point similar to you where I'm like, no. If I lay in my bed and watch Netflix, that is not a bad thing. I'm not a bad, lazy person. I'm actually like recharging myself so I can go into the next day with more energy. So I really like that advice. And then similar to that, we were talking about how being separated from other people, as you said, you moved to a new apartment and were very isolated. How can young people find that supportive community that is so crucial during like education or just growing up? It's really important to find a community of people you can relate to. How can young people do that when everything's online and we're separated? Do you have any advice for that?
Yeah, sure. So I actually also just started a new job and it started virtually, which isn't, the ideal start at a new job that I expected. And that was one of the things that I really struggle with the most, just finding people that I can talk to and trying to make new friends at work. And I would just say there's definitely a lot of resources, support groups, online communities out there for anyone looking for help. You just have to take a bit of time to find them and reach out. um for me at work, for example, I knew a couple of people going in and I reached out to them saying, hey, I'm looking to make some friends, meet some people, and they ended up connecting me to a whole bunch of people who in turn connected me to more people. So I kind of, met a lot of new people and made some good friends, and now I have a bunch of people that I can reach out to when I have questions or just need someone to talk to. Similarly for us at Runaway, a lot of people, when they're looking for resources, when they're just looking for someone to talk to, people will either DM me on my Instagram or Runaway's Instagram just to have a conversation. But I also know people who use Facebook groups, for example, people who use Reddit communities, and things of that sort to just find help or just find, like-minded individuals who are interested in similar things as you to just talk to and keep that social connection going. I've also been doing Zoom calls with my friends. We recently just played Among Us for the first time, which was a lot of fun. And so there's definitely like ways that we can keep ourselves still have that social aspect, because I think one of the biggest mistakes that was made at the start of quarantine was calling it social distancing. But really, we don't have to be socially distant. We just have to be physically distant, and we can still maintain that social connection through all the online tools and everything else that we have available now.
I love that that idea of, I never thought about it that way, that you don't have to be socially distanced. Physically distanced is very ideal, but you don't have to be socially distanced. I really like that. It's so true. I think that's a good thing about social media, is that it can connect people. I've like definitely started reaching out to friends I haven't talked to in years and reconnecting with them. I think like one of the few silver linings of this time is that it really shows you like who your true friends are, like there are people who like, just knowing who you value in your life, and you have the opportunity to reconnect with them and talk to them. You don't have to like be near them anymore. So that's really good. That's good advice. And then also, as you were mentioning earlier, one of the struggles during this time is just the sheer amount of overwhelming news that we're just bombarded with every single day. I think this year has just been insane for that. We've been hearing about so many problems going on, problems that didn't start this year, but it's a privileged position to say, oh, we're only hearing about it now because there are people who have been going through issues their entire lives. But I think for a lot of people, like, because we don't have anything else to do, we're just sitting at home and just so much information is flooding us, negative news, with like police brutality, environment, racism, just all these inequalities. In America, there's been huge, and I think all over the world, there's been economic depression. People have had, their parents might have lost jobs. Depending on their age, they might have lost jobs, food insecurity, just all these struggles. And I think personally, I've found that it's a struggle. There's just like a kind of conflict between the urge to stay informed and be aware of everything that's happening in the world, being a good global citizen, but also if you are constantly paying attention, it's so easy to get overwhelmed by the negativity. So do you have any advice on how to balance those two urges about staying informed, but also not getting overwhelmed?
Yeah, for sure. Again, something that I've been seeing a lot of for me personally in my life, because I have like this mental health platform and, people look up to me often. A lot of people will reach out and say, hey, why aren't you talking about this issue going in this part of the world? Or, you spoke about this issue, why aren't you talking about this thing going on right now? So for me, I often feel this pressure and burden to constantly stay on top of things. And what it leads to often is, and these are terms I literally just learned this year, but there's firsthand and vicarious trauma, constantly looking at these negative situations that people find themselves in, and often feeling helpless about it. And then there's the component of empathy fatigue, where I'm constantly having to talk to people and, assure them that everything gets better when there are times where I myself am not sure if things are really getting better, and I feel that helplessness. And for me, I mostly get my news. This might sound really bad for anyone watching, but I mostly get it from Twitter because I love that I can not only get the news articles to read, but also simultaneously hear people's opinions on it and get both sides of the story. Um, and it gets bad sometimes, like I'll see videos come up or I'll see news articles, and there are people who might not have the exact same ideology as me, and that often frustrates me. But I think what I found best for me is realize that there is a breaking point and there's a limit to how much information you can take in, how much information you can process. And so when I feel like I'm getting close to reaching that point, I'll just take a break. And I completely understand that this is a situation of privilege. Not everyone can just turn off the news and that thing stops for them. These are realities that people live in every day. These are realities that people have to deal with every day. But to them, I will say that there are a lot of things going on, but hopefully things will change. And I'm definitely seeing, especially with youth, we've been getting so much more involved. We saw with the elections, the voter turnout that happened. We've been seeing it with all the protests that have happened, that the youth are really starting to understand the impact of these struggles and are starting to really use their voices, because at the end of the day, we're the future and we're going to be the ones who bring that change. But I will again emphasize that when all this information gets too much, just take a break. I took breaks from social media a few times this year where I just deleted all social media for a week or so. I'll often just close the app and go read a book or watch some Netflix when I think Twitter is getting too much to handle. So just stay cognizant of, what is your breaking point. And if your mental health starts to get bad, just take that break, do that self-indulgent task.
Yeah, thank you so much. That was a great response. And I hadn't really heard of terms like empathy fatigue, but that's a great term to describe what I think a lot of people are feeling. And I liked how you mentioned that a big part of this anxiety around the news is feeling like you're powerless to do things. I think, well, especially during a pandemic, I'm like, oh my gosh, these terrible things are happening in the world and I can't even leave my house. Like, what am I supposed to do about them? Also, I think as young people, it's even easier to feel powerless because, a lot of us, almost none of us are in real positions of power where we can directly affect change. And unfortunately, a lot of people in power aren't super keen to listen to us. So I think that empathy fatigue, that feeling of powerlessness can really be amplified. But I think that's a great idea. I think taking breaks sometimes is really important because it doesn't mean you're ignoring the issue. It doesn't mean you're giving up on the issue. It just means our brains can only handle so much stress and information, and we cannot solve every issue if we're thinking about every issue all the time. We'll burn ourselves out. And I think I completely agree that by taking breaks and recharging ourselves, we can actually solve the issue more effectively. It's not like putting all of our energy all the time to solve an issue is not going to solve it. We're going to get burned out. That's just not how change happens. You have to work at it, but take breaks, take time for yourself, check in on yourself, and then that will make you more effective at actually solving the problem. So I think that's really great advice. Yeah, and I also agree that not to pat ourselves on the back, but I think young people are very inspiring. And like that has been another one of the silver linings of this pandemic is that I think a lot of people have found their voices. Young people, I've just been so inspired. I'm like hanging out in my, as you said, in my sweatpants, like with a pint of ice cream in my hand, and I'm like, wow, there are young people who are at home who are organizing protests and raising money and doing so much good, even during this, especially during this crazy time. So that is one inspiring aspect of it. And so just for another question, we were talking about, these really strong negative mental health effects. And one thing that I've been really wondering about, and you're not a fortune teller, so don't worry, I don't expect you to have a perfect answer, but I've really been curious about whether these mental health impacts that we're seeing, when everything opens up, it won't be probably soon, but eventually everything will open up again and this crisis will be over. I'm really curious to see if if people will just go back to normal, if people will be able to move on, and like their mental health issues and depression and like loneliness that they were feeling, will that just be alleviated and kind of go back to pre-pandemic times once everything's opened? Or do you think that people will have like long-lasting mental health impacts due to the environment that we're in that will last even beyond this current situation? Do you have any opinions on that?
Yeah, so I'll give you the answer to your question and then also offer a slightly different perspective. So the first thing I want to say is that I don't think anything is going back to a normal that we knew once. I think this is the new normal and something that's gonna almost stay consistent. You know, I've been having conversations with my friends, with my family about how just COVID-19 in itself is not something that's just gonna disappear one day. We'll just get better at kind of getting used to it, dealing with it, sort of like the flu every year. So that's one aspect of it. When we talk about mental health, I think there's going to be some people and some challenges that will disappear eventually, but then there's also deeper trauma. You know, there's been so much loss of life, for example. So for those families, that trauma is going to be carried on for years. Um, but looking at kind of the brighter side, while all these things have happened, you know, there's going to be mental health problems that go into the future. There have been some positives, and that's kind of like the other perspective that I want to offer is I've been working with some amazing mental health activists from around the world to conduct research with Wellcome Trust UK specifically on this and what the positives from COVID-19 have been. So one of the best things that I've seen is there's so many more resources when it comes to mental health now. You know, every day I see commercials for different mental health apps or different mental health communities that are starting. Corporate workplaces have started to take mental health more seriously. I've seen so many companies offer different wellness programs or mental health days to their employees to take care of themselves. Work from home is something that was so inaccessible in the past, but I think the pandemic has showed us that so much of what we are sent into the office for can actually be done from home. And I think that could be a huge help for people with mental illnesses or health disabilities. And so all these things, you know, a lot of, for me personally, I feel like I've connected a lot more with my family. Like you were saying, you've reconnected with some old friends that we had completely lost touch with. So as much as, again, you know, recognizing completely that this is a privileged statement, but I think for me, I'm trying my best now at this juncture to focus on the positives. And in a way, it's made me very hopeful. You know, everything that we've seen change for the better, youth getting more active, youth getting more involved in everything. So I'm really hoping that while the negative side will definitely persist into the future, we can also retain some of these positives, lessons or acts that we've seen this year, carry on into the future so we can continue to work together to make it better.
Yeah, that's amazing. Thank you. That was really insightful, and I really like what you were saying about how, well, we're not really going to go back to normal. Things are definitely, as I've heard the phrase so much, new normal. There's going to be changes that our world is not going to be the same, and we have to decide what kind of world we want to move forward into. And there'll be negatives and positives. I think also a lot of young people have really become, and everybody has become much more resilient. I think we've become more accepting of change. And so hopefully those changes, that acceptance of change, will help us solve some of the more systemic problems that, as you mentioned, this pandemic is showing us that these problems in society that we just assumed we could never solve, we actually can. Like, I like what you were saying about working from home. Like a year ago, if you told us that everybody would be able to work from home, like we would have thought we thought that was not true. Like, how could that happen? How could everybody be doing things from home? We're rethinking everything in society basically and reformulating it. So hopefully that can bring about some real changes. But yeah, that is a great response. I really love that. And then for one of our last questions, as our time draws near, as you were mentioning a little bit earlier, there is really, unfortunately, still big stigmas around mental health struggles. I think especially among young people, it's really hard to talk about and really hard to share. So how do you think we can collectively break those stigmas around mental health problems?
Yeah, so that's a pretty loaded question. Something that I've tried to, through my own work and through Runaway's work, try to work towards. and just kind of normalizing the fact that, just like we all have physical health, sometimes our physical health goes bad, you get injured, you have a headache or something, and you recognize that problem, you tell people that you have a headache, you get a medicine, you treat it. Similarly, everyone has mental health, and it's okay also for our mental health to go bad from time to time. And so when it does, we need to recognize that it's a problem that's affecting us, and we need to find the right help for it. And obviously the right help could look different for everyone. For some it might be a simple task is just achieving something during the day that could give you that kind of self-confidence, sense of achievement, and make you feel better. For some, it could be finding peer support. For some, it could be talking to a therapist, or for some, it could be actually getting medication. But I just think that the first step in breaking down that stigma is just accepting that you have a mental health problem and finding the right help for it. But I think the best way that we can work towards breaking down the stigma is just really starting small, starting with our own friends, starting with our own family, and just opening up these conversations. I know it's not the easiest conversation to have, to just, tell a friend who's always seen you as this happy, bubbly person, and for you to suddenly tell them that you have a mental health problem, or for your family who might be carrying their own generational stigma when it comes to mental health, to open these conversations with them and, tell them honestly that you're having problems and you want to get help. Those are hard conversations, and I completely understand that. I've had to have those hard conversations with my own family, with my own friends. But I think once you overcome those initial conversations and initial hesitance about talking about mental health, I think what we can achieve together is something really beautiful, where people don't have to hide the problems and the challenges that they face. And there's more acceptance of just mental health being normal. And I really think that can easily happen if everyone just accepts it and normalizes those conversations.
For sure. And thanks to people like you who are spending so much of your time trying to, normalize it and provide forums for people to reach out and get the help they need. I think that is more impactful now than ever. And I definitely see the effects of that among young people. I think for all of our challenges, our generation is kind of the most accepting I've seen of mental health issues. I think we're kind of cultivating that awareness that everybody has. I love your phrasing that you said, everybody has physical health, everybody has mental health, and a lot of people do have mental health struggles, and that's not a shameful thing that you have to hide away. Like if you broke your leg, you're not gonna pretend to try to walk normally around everybody and just try to ignore your pain and pretend everything's normal, hide it away. You get help for that, and
Exactly.
you have to hide it. Yeah, and so I think that's another thing that really inspires me about our generation, that I think we're making it much more acceptable, but we have a long ways to go. But I think people like you are definitely helping us get there.
Thank you.
Yeah, and so I think that kind of brings us to the end of our discussion. Satvik, thank you so much for joining us. This was really amazing. Do you have any final words you want to talk about, any final advice you want to give, and then maybe provide any social media handles or places people can follow up if they're interested in your work?
Sure, yeah. So I just want to say, for my final words, one, thank you so much for having me. I really enjoyed this conversation. It's always so nice I'm like young, but I don't consider myself too young anymore since I graduated and I'm working. So it's always nice to kind of talk to young people about mental health and just kind of, as you said, the inspiring energy that people are bringing towards social causes now. But I just want to say to anyone watching, just know that where you are today does not dictate where you will be tomorrow. So if this moment, if right now feels stressful, if there are things that you're going through, just know that eventually things will get better. Not just with COVID, but just your own mental health, your own situations. So just stick through it, keep believing. And I strongly believe that just being there for each other, checking in on your friends, staying updated with any social causes, any news that's going on in the world will eventually make the world happier. And in terms of reaching out, if you ever want someone to talk to, my DMs on Instagram are always open. You could follow me or reach out to me at Satvik Sethi on Instagram. Runaway's account, which features a lot of mental health education, a lot of positivity, is runaway.app on Instagram. And you can also just email me at satvik@runawayapp.com. So always happy to talk to people, connect them to the right set of resources for them, or even just be a friend and, give you a safe space where you can vent about anything you're going through.
Great. Thank you so much. We really appreciate your time, and thank you so much to everybody for being here and for joining us today. And if you want to join, we have one more discussion in our series coming up on November 17th at 4 p.m. Eastern Time. Another COVID-19 fellow, he's amazing. Mohammed will be talking, he's from Morocco, and he'll be talking with Dr. Joshua Sharfstein, the Vice Dean for Public Health Practice and Community Engagement at Johns Hopkins. So it'll be really informative. Please look into joining us for that. And again, thank you so much for being here today.